Hello, Chair Kogan, commissioners, thank you for your time today. I have all this stuff scratched out because I scratch out everything that somebody's already said. So hopefully I'm not repeating what anybody else has said. But I just want to say my name is Cynthia Gomez for the record.
No one else has said that.
I work at Latino Network as a program director and a Latina and a mother of two little girls, 7 and 4. Latino Network supports you in hopefully endorsing this ban with organizations like OPAL and the Oregon Environmental Council. We know that some stores sell BPA-free baby products, but not all families can easily access these stores. We know that the existence of BPA is clearly a health equity issue. We know that families in urban low-income communities often rely on small corner markets and dollar stores, and we know that these stores are notorious for selling cheaply made items that may not meet safety standards. One of the things is dollar and corner stores are also less likely to carry newer BPA-free products. As a consequence, children in communities that rely on these markets for infant formula and baby products may be at a higher risk. BPA is especially challenging issues for Latinos because information about BPA is mostly in English, and that happened. Actually, I went to a pediatric appointment with a family, and I was talking to the family about BPA, and they asked for information. Not only did they not even know anything about BPA, but they also didn't have any information about it, any literature about it in English or Spanish. And when you go online, it's just really hard to find this stuff. So while some manufacturers have discontinued its use, BPA is still found in a wide variety of products. Because there are now so many BPA alternatives and bans in neighboring states, I share the fear with many in the room that that the last remaining BPA containing products may end up in our corner stores. So in outlying counties, the stuff's going to get pushed out. People are going to have higher exposure. So we just got to watch out for that.
Thank you.
Mm-hmm.
Morning.
Good morning, Chair Kogan and Commissioners. My name is Eva Roberto, and I'm here representing members of Oregon AFSCME Council 75. And thank you for allowing me some time today to speak in support of the ban of BPA. In addition to representing employees of Multnomah County, there are well over 5,000 AFSCME members living here, Our membership includes child care providers, employees of the City of Portland, Metro, OHSU, and a variety of state agencies like DEQ and nonprofits. And I'm going to repeat some things that you heard, but it'll sink in, right? Because many of our members work in health-related fields or care for children every day. We view Bisphenol A as a moral liability. BPA is found in 93% of Americans aged 6 and up, and with evidence showing that exposure can impact brain development, reproductive health, and is linked to causing cancer, it is important that we curtail exposure at an early age. Banning BPA in bottles, sippy cups, sports bottles, and thermoses will ensure that all families have access to products that are safe for their children and reduce risks of adverse health effects caused by BPA. And as you well know, as employers, that's a big cost on your health insurance costs as well. So while you can find BPA-free bottles and sippy cups throughout Oregon and Multnomah County, not all stores have the same availability or customer information provided at that point of sale. I would like to say AFSCME is also very proud of our library employees' efforts and success in working with the Multnomah County Library to move to BPA-free receipts, thus reducing exposure to library workers and patrons. We see the proposed ban on sippy cups and bottles as another step in the right direction and encourage the Board of Commissioners to pass the ban on Bisphenol A. Thank you again for the opportunity to speak, and I'm happy to answer any questions that you might have.
Thank you very much.
Hi.
Morning.
My name is Lisa Marie Morgan. I'm here to represent my family. Specifically, this is my son Ezra. He's 3, and my daughter Mila is 5. She's in kindergarten right now. But we're marrying these medals. We just got them last night at a thank you dinner for American Diabetes Association. Every year we fundraise for the Diabetes Association because my daughter, who's 5 now, has type 1 diabetes, which means that 5 times a day, if not more, she gets a finger prick to test her blood, and she gets 3 to 7 shots every day of insulin. I thought I was over the crying phase of diabetes. there's many reasons, or there's lots of discussion about why type 1 diabetes is happening more and more commonly in children at her age. She was diagnosed at 18 months, 1.5 years. The average age used to be 14 years old. She's one of 3 people in our social circle that has type 1 diabetes at that age. One thing that researchers do agree on is that type 1 diabetes is an endocrine disease, and as has been shared many times today, BPA is an endocrine disruptor. So I ask you on behalf of my little girl Mila to support BPA, because she's one of many children that are being affected by this toxin every day. So thank you.
Thank you.
Thank you to Chair Kogan and members of the Multnomah County Commission. I'm Sharon Myron. I am here both as a mother and as an emergency physician. I am not going to go over all the science and all of the many facts that have been presented that are very convincing why a ban on BPA is so essential in our sippy cups and in our baby bottles and in our reusable beverage containers. But just to add to the personal anecdotes, my children are now 5 and 8, and we used bottles and sippy cups that we had no idea what was in them or what it could do. And they're now found out about BPA just as they were kind of getting out of the phase of using those things. And as a mom and as a physician who, tries to be educated on these things and do the right things for my children, I am devastated by the fact that we have used those. I could not more strongly support this ban. I'm so glad you're taking it on. In the guise as an emergency physician, and I am president of our Oregon College of Emergency Physicians, we see every day in the ER pediatric. We see kids who come in and their parents are using the bottles and the sippy cups, and we see the effect of income disparity, and you see who's using the ones that clearly are BPA free and who seems to be using the ones that aren't. And there is a gross disparity, and this ban is essential.
Thank you. Thank you very much.
Thank you.